give that another go. So good afternoon, everyone. Thank you so much for joining us for this month's Teach Educational Rounds. Here with us today, we have Dr. Amit Rotem and Dr. Trisha Tulloch, who will be presenting on vaping in youth, trends and approaches to assessment, interventions, and treatment. Before I hand it off to our presenters, I'm just going to go through a few housekeeping slides. Let me just go through those. So if you're interested in obtaining a letter of completion for this Teach Educational Rounds, please make sure you have registered for this webinar and completed the pre-learning assessment. As well, make sure you have signed into this webinar using your full first name and last name so we can track your participation. And finally, please make sure to complete the evaluation and post-learning assessment. That will be emailed to you by the end of tomorrow. And you have 1 week to complete that. And please note that a copy of today's presentation slides will be sent along with the recording this afternoon as well. So here's a little bit more information on our presenters today. We have Dr. Amit Rotem, who we are just waiting on. Hopefully he'll be able to join us very shortly. Dr. Rotem is affiliated with the Youth Addiction and Concurrent Disorders Services and Addiction Medicine Services at CAMH and SickKids in Toronto. Dr. Rotem has published clinical studies, reviews, chapters on youth and adult addictions. He is actively involved in teaching medical students and supervising residents and fellows at the Division of Psychiatry and Pediatrics in the Faculty of Medicine at U of T, as well as doing national and international seminars in addiction psychiatry. So then we also have Dr. Trisha Tulloch, who is an adolescent medicine specialist in the Division of Adolescent and Medicine and an assistant professor in the Department of Pediatrics at U of T. She completed her pediatric residency training at Ohio State University, subspecialty residency training in adolescent medicine at SickKids, and clinical fellowship training in addiction medicine at CAMH. Dr. Tulloch is an associate staff physician at SickKids and Centenary Hospital. She is the vice chair for the Royal College of Physicians and Surgeons of Canada, area of focus competency in addiction medicine. All right, and so here is a list of their disclosures. So no disclosures for them, and just a little bit more information on our disclosures. And please note that the content of Teach Educational Rounds are centered on evidence-based guidelines from the following sources. So nonetheless, these materials, as well as the verbal presentation and any discussion, represent only general principles, and they do not remove the need for clinical assessments or treatment plans by healthcare professionals. So please feel welcome to use the chat feature throughout our webinar to post any comments or answer any prompts from the presenters. To do this, you can click on the speech bubble icon in the control panel, and please ensure you select everyone so that all panelists, hosts, and attendees can read and respond to your comments. We will also be using the polling feature in today's webinar. So to use this, it should pop up and you can click on your response and then hit submit. However, all content-related questions will be answered at the end of the presentation. So please keep note of anything that comes up, and then you can post them in the chat during our Q&A period for our presenters to answer. So with that, I just want to check and see if Amit has now joined us. Let me see. All right. So we'll just give him a couple more minutes. Trish, have you gotten any update from him?
Yeah, Dr. Rotem is actually, he's there.
Is he there?
Yeah.
It looks like he may not be set as a panelist. Let me just check and make sure he is a panelist. Sorry, everyone, give me 1 second. I want to make sure that he can unmute himself. Okay. Don't seem to see him there. Are you able to see him, Trish?
Yes.
Okay, perfect. Amit, are you able to unmute yourself? Oh, there. Okay, 1 second. I see him. There we go. Okay. Hi, Amit. Are you there? Amit.
Yeah, I'm here. Can you hear me?
Yes, we can
I
now
was
hear.
here from the very beginning.
Ah, okay. For some reason, you weren't under a panelist. But anyways, all good. All right. So I will now hand it off to you both to present. And thank you, everyone, and enjoy the webinar.
Thank you, Natalie.
Mhm.
Just make sure that we're okay in terms of the audio. Is there any feedback, or is this clear? Okay, great.
On my end.
Okay. So next slide, then, if you could.
Mhm.
Okay, so welcome everyone. Definitely our pleasure to be here today as part of this webinar. And just in terms of the objectives for this session, so we're hoping that at the end of the session that you will be able to describe the trends in adolescent vaping and nicotine product use, that you will also be able to review and describe the approaches with respect to screening and the clinical assessment in terms of the assessment for adolescents who are engaged in vaping. And finally, we're hoping that you will be able to summarize interventions that target vaping cessation with respect to the strategies that we will discuss for adolescents. So without further ado, if we could go to the next slide, we'll start with just a quick poll. So just would like to get a sense of your practice. And so this question is specifically asking about what proportion of your practice is comprised of adolescents. So we'll just take a moment to see what this looks like for everybody. I'll just take a few more seconds there. How does it look in terms of responses there, Natalie? Okay, great. So let's close this poll and we'll see what we have. Not sure if we're able to post the responses, are we? Or oh, no problem. Okay, thank you. Okay. So definitely a larger proportion of us here have less than a quarter of our population who are adolescents. But there are some who are working with over 75% and somewhere in the middle. Okay, great. All right, so next slide. So we'll start with a case, and hopefully this will help to kind of frame our discussion throughout this session. So we have a 15-year-old male who has a history of asthma and attention deficit hyperactivity disorder. And he arrives with his parents for a routine clinic visit or any visit. And the parents are requesting to speak with you prior to you having a conversation with the adolescent. And the parents they disclose that they've discovered a pack of cigarettes and a vaping device in their son's backpack. And they're not quite certain as to how to approach this. They've already expressed their concerns, and at this point, they are seeking recommendations. So just for a really brief discussion, if we could go to the next slide. The question that we'd like to pose, and if you wouldn't mind just adding maybe a few comments in the chat box, to the chat section. So if you were the provider, how might you approach the adolescent? So what would be the kind of the things that you might consider specifically approaching the adolescent in this scenario. Just looking to see if I see any comments. Any thoughts about this? You have a 15-year-old male. It's essentially, yep, so someone's asked, what are your thoughts about vaping? Oh, great. So someone also mentioned I would firstly not discuss with parents and would ask, oh, I just missed that. And would ask open-ended questions, concerns, begin to discussing the child's ADHD history. What do you know about nicotine? Okay, great. These are great questions. And I think the primary concern that we wanted to make sure that we brought up was the aspect of, and the probably the most kind of fundamental aspect of care for adolescents is confidentiality. And yet, yes, the parents are concerned. However, if the adolescent is the client, the patient, really we would start with the adolescent and have that discussion immediately with respect to the limits of confidentiality before engaging in a dialogue with parents. So that's great. And there's lots of great questions here that we'll come back to as we talk about this case. Next slide. So we'll first really a brief overview in terms of some of the trends with respect to vaping and nicotine product use. Next slide. So what we have been seeing pre-pandemic, which is, I think, just kind of sets the stage for what we have been observing over the past few years, is that we've been seeing an increase in the number of substance-related hospitalizations. And specifically, and somewhat interestingly, a lot of the hospitalizations have been related to cannabis and cannabis-related sequelae. So although we won't be focused on cannabis, we bring this up mainly from the standpoint of the use of the vaping device itself as clearly a mechanism or a way of consuming cannabis. And we are really kind of thinking about the use or vaping in and of itself as an adolescent behavior. And so this is really kind of a key factor, a key point that we need to consider as we're thinking about the trends that we're seeing. So next slide. So in Ontario, we have a student drug use survey every 2 years. This survey is conducted across high schools, and it is through the Centre for Addiction and Mental Health. And so I just wanted to get a sense of kind of our overall understanding of what the 3 most reported substances were with the last, so 2019 survey, which was conducted. First option, alcohol, energy / caffeinated beverages, cannabis. B, alcohol, energy drinks, e-cigarettes. C, alcohol, cannabis, e-cigarettes. D, cannabis, e-cigarettes, and energy drinks. So just curious as to what our understanding might be around the highest reported substances amongst our high school students. Okay, let's see where we are. Oh, that's okay. And we can actually move forward to the next slide just in the interest of time. Interesting. Okay. Quite the spread, in fact, actually. The answer is B. So in 2019, it was alcohol remains the most, the highest reported over the past year when they asked about past year of substance use. And then followed by that, energy drinks, and followed by that, e-cigarettes. And it's interesting because cannabis, I think we've most commonly seen cannabis in the top 3 substances. So you can see actually in the second graph, so on my right, your left, that there is a, so the circles represent the 2017 data, and the orange bar represents 2019. So that we're talking about the prevalence. So you can see the shift over the course of 2 years, specifically if you look at e-cigarette use, so vaping, and cannabis as well. Next slide. In terms of trends with respect to our Canadian high school students and our US, the US data, and so in comparison, similar numbers, in fact. So over 30% of Canadian high school students reported past 30-day e-cigarette use, and this was in 2019. And similar in terms of the US high school students who reported, so over 30% reported past 30 days e-cigarette use. And the Youth Risk Behavior Survey found that 50% of US high school students reported ever using an e-cigarette. Next slide. What's been interesting is over the past few years, so really throughout the pandemic per se, or really kind of predating the pandemic, what has been noted is this either a plateau and in some instances a bit of a decline or a decrease in the proportion of the prevalence of adolescents reporting vaping. And if you go to the next slide, so the first slide captured vaping overall, so that it encompasses cannabis, nicotine, and any substance that an adolescent may be vaping. And this slide specifically addresses nicotine. So what we're not too sure about at this point is what are all of the potentially the factors that are playing into this trend. And there's definitely some thought that there might be some underreporting due to the context of where we are within this pandemic. There has been some data actually supporting a similar trend here and across Canada as well. So when we think about substance use in general with respect to adolescents, there are definitely some risk factors that we consider. And so as we move towards this discussion with respect to screening and the assessment, just taking a step back and thinking about the adolescent and all of the kind of the components, the factors that would contribute to their presentation or the potential for developing a substance use disorder. So those include family history, the concurrent picture of mental health diagnosis such as anxiety or depression, ADHD. Now, so specifically mentioning that as we had alluded to that with respect to the case that we initially presented, the adolescents who are within the LGBTQ population, peers, if your peers are using, particularly if there's early initiation, adolescents who have chronic health conditions, those with learning disabilities, and adolescents who present with a history of either abuse and or trauma. Next slide. So in addition to those factors and potentially if we kind of think of them as the some of the kind of the key risk factors, we also need to think about their developmental trajectories. So the early, middle to late stages of adolescence come with their own kind of host of developmental tasks. And so if you think about our early adolescents who are more concrete, have a bit more of those challenges with respect to putting the brakes on in terms of their use of their prefrontal cortex, in terms of just executing tasks, being organized, and thinking beyond responding to their emotional needs or their need for immediate emotional gratification. So the most important, I think, aspect here with respect to considering who we're kind of speaking with, or you know, where the adolescent is in terms of their developmental stage, is that it does certainly have some significant implications with respect to how we may engage in a discussion in terms of treatment. So if we think about the individual who presented to our 15-year-old who might start a conversation with, they may actually have more of a more concrete way of thinking. And so if we ask if they're smoking or if they've ever used substances, they may simply shrug their shoulders and say, no, no use at all. And yet their parents are, describing and even maybe showing you all of what they've found within their backpack. So, it's important for us to think about where the adolescent is and then how we might use that information to inform our approach. In addition to that, this also informs how an adolescent actually, sorry, just going back to that slide, just one moment, just how they engage with their peers. So as they move throughout adolescence, peers become more of a focal point in terms of the way that they would socialize. And vaping in particular, with respect to the behavioral aspect of it, is very much a social kind of phenomenon. And so that peer pressure is really a key component with respect to how and what we're seeing in terms of the trends with respect to vaping. Next slide. Interestingly, there has been some literature published on what seems to be potentially factors that mitigate an adolescent's interest in vaping cessation or even preventing the initiation of vaping. And some of the literature actually points to a strong association with their understanding of health effects, which is a little bit counterintuitive in that we often don't spend a lot of time talking about the negative outcomes, because oftentimes that has really no impact on the trajectory with respect to any type of behavior, substance use being, in this case, really vaping behaviors being our focus for today. So with respect to vaping, we definitely know of the respiratory consequences, lung injury or just lung illness in general, and neurological consequences such as seizures have been also associated with vaping. We've seen GI, so gastrointestinal illnesses, nausea and vomiting being some of the symptoms that you may see. And certainly, the concern in terms of nicotine and the addictive properties. There's some data that reports how we might communicate this information with teens in a way that they may have much more of a kind of an interest in engaging in that dialogue. So for example, the athlete and linking the respiratory effects and in terms of their endurance, so the effect, the negative impact on their performance. We may talk about chronic illness and the kind of increase or the worsening of their chronic illness with respect to the engaging in vaping as well. For those, and most adolescents do tend to have some interest in kind of the cosmetic, their cosmetic kind of overall in their appearance. So maybe just engaging in a dialogue around their understanding of either the way that vaping may have an effect on their oral health. And some of the discussion and some of the data points to their understanding about the financial implications as well. Next slide. So in terms of the toxicity of nicotine specifically, this is definitely an area that we have been spending a fair amount of time in terms of our discussion and our clinical work with adolescents, as they have been, and we've been seeing a significant amount of nicotine consumed in, really kind of, I'd say probably not just the frequency, but certainly like the shorter duration or shorter kind of sessions where adolescents would use increasing concentration of nicotine over the course of a short period of time. That's the best way to word that. So what we may see is increased alertness, palpitations. Certainly we might on clinical examinations see an increase in terms of their blood pressure or heart rate. They may report reduced appetite. And in terms of the symptoms they may have, if they're acutely withdrawing from the effects of higher concentrations of nicotine, they may report headaches. They may notice that they're feeling a bit more anxious, having difficulty with concentration, feeling more restless, maybe even experiencing tremors or dizziness. So certainly we can see these symptoms, and adolescents may report these symptoms. Sometimes they're not aware of these symptoms. And so it may be our observation and kind of bringing this to their attention as we are engaged in dialogue with them in our clinical settings. Next slide. The more common effects, though, of nicotine toxicity tend to be along the lines of the neurological, gastrointestinal, so the more of the abdominal discomfort and headaches, as I mentioned, in terms of neurological concerns, and decreased concentration in terms of toxicity. Next slide. And these are similar symptoms that were just previously noted in the previous slides. We can go ahead with the following slide as well. So we'll now move forward with respect to screening and the clinical assessment. Next slide. And sorry, next slide. So as we were thinking about our 15-year-old, there were some really great questions that we noticed in the chat, kind of starting off with even their understanding of vaping, their understanding of the effects of nicotine. I'm really asking them specifically, do they use any vaping products like e-cigarettes, and really being quite as direct as we can in terms of these questions, because oftentimes if we ask a very kind of broad and vague question, as previously mentioned, particularly when we're thinking about our adolescents in the early phases of adolescence, we may often be in a situation where they may give us that either yes or no, or shrug, or I don't know type of response. So if we can be as specific and kind of provide a little bit of a context, that tends to be helpful. So even asking about, so do your friends use products? And if in fact your friends are using, have you ever been tempted to use, and kind of ease our way into that dialogue with the adolescent. Once we've had an opportunity to sort through whether or not they have been using, and if in fact they do disclose this information, the next question really is, how much have they been using, and have they been using over the past, and decide on the duration of time. Next slide. And I might just want to click a few times here. So I'm not sure if maybe in the chat feature here, if anyone might be able to just let us know if you've in fact used the HEAD psychosocial assessment as a framework to engage in discussions with adolescents. Just kind of curious if anyone's familiar with this tool. Just trying to see if I can see anyone's answers. So far, no. Okay. Okay, so I might just briefly talk about this tool. It is widely used, and there's a lot of data supporting this approach. And essentially, it's a way to open up the dialogue and acquire additional information even before engaging in a discussion pertaining to substance use, and in this case, specifically vaping. So what we start to talk about with adolescents is just some general information about their home environment, their school environment, if they're employed, and what they may be engaged in terms of activities. And as we're asking these questions, and we're trying our best to kind of direct a bit of it towards where are these protective factors, where are the risk factors. So we talked about, for example, in the home environment, there may be, and they may be aware of, a family member who has a substance use disorder, and that may come out in that discussion even before we get into further questions pertaining to their maybe history or current use. In addition to that, when we ask about activities, we ask about peer-related activities. So what are they doing throughout in their free time? So are they engaged in activities where they may be in person? In this case, a little bit tricky with the pandemic, but really quite relevant as some adolescents would spend time outside of the home, meeting up with peers, and that would be an opportunity where they may actually find themselves having some challenges with disengaging or refusing, or kind of not necessarily refusing, but finding it more tempting and engaging in substance use. So those environments they may be able to start to kind of describe, and again, an opportunity to just get a sense as to what's protective and what may be where there might be some additional risk. In terms of social media, this is where we would ask a bit more about what they're actually doing online. This may be where they potentially might be even purchasing substances online, and so just kind of getting a sense about their use of media, their device. In addition to that, so I'll skip over substance use for just a moment, but their riskier behaviors also being a key part of that history, in that we definitely know that adolescents who are victims of trafficking, the data shows it about, or at least over 90%, tend to be also engaged in substance use. So understanding where those risks are also really key. So again, this is a framework. There we have the references that we've provided, but there is a lot of information that supports the use of this framework, and some of the resources that actually elaborate on how you might ask the questions. So next, if you click again, Natalie. And we mentioned addressing confidentiality being really key, and then one more click, I think. Great. Okay. So with respect to substance use, some just basic questions. We talked about just kind of quickly asking a bit about their substance use. And Dr. Rotem will actually get into more detail as we start to talk about which substances, how much an adolescent's using, how they're using it, how often, and how long, and specifically as we frame this within the context of vaping. Great. Next slide. So this is the screening tool that we use, generically speaking, to assess for substance use with respect to problematic use. And it's the CRAFT questionnaire, CRAFT interview. And again, I just would like to get a sense from those here in the audience if this is familiar. It's kind of a yes or no, if possible, as I kind of provide a bit of a description. Okay. Okay, so a lot of no's, and I will just point you to, again, this screening tool. So the two, I think, take-home tools that I would encourage you to take a little bit of a further delve into in terms of the literature and also just the use of these tools would be the HEADS screening framework assessment tool and the CRAFT interview. So the CRAFT interview encompasses two parts. Part A asks specifically about substance use, and the most recent version includes vaping. And the key piece here is to get a sense as to whether an adolescent has been engaged in any substance use over the course of a 12-month period. So you can see how that would be in keeping with the DSM-5. So we're getting closer to thinking about diagnostic clarity if in fact substance use or substance use disorder is a concern. And beyond that, when we are asking about substance use, if there is yes to any of the substances that are listed, and then we would move on to asking six questions, specifically asking about whether they've been in a car driving with someone who's under the influence, or if they themselves have been under the influence. And again, as I mentioned, vaping is included. One thing to note, although we aren't touching on vaping cannabis, but you can see how that would be relevant here if in fact an adolescent is vaping cannabis or they're in a vehicle with someone who is under the influence. The R is specifically asking about whether they're engaged in substance use in order to feel relaxed. And so when we think about our 15-year-old patient or client who's presenting, maybe this might be where you might get a little bit more information. They may actually say, yes, you know what, I've been vaping a bit more, so I feel a bit more at ease with my peers. And then we would go on to asking more about whether they are using alone, whether they forget things while using, are there friends or family members asking or inquiring about their use and encouraging the reduction in terms of their use, and have they ever been in trouble? So even if the adolescent says no to any of these questions, what is key is that we still would ask about the first three. And you can see, at least for the first question, and so we'll just go to the next slide. And you can click a few times, sorry. Oh, sorry. Oh, yeah, this is the night. So you can see for this slide in particular, this is 2017 data. The high school, so the Ontario Student Drug Use Survey, the report for 2017 is that over 24,000 grade 10 to 12 students reported driving after the, essentially under the influence, so after the use of cannabis. So this is 2017 data. We can see that why this would be important to certainly still ask this question, irrespective of whether or not an adolescent is reporting use. So this is an opportunity to provide harm reduction and really to start a dialogue around safety, at the very minimum, in fact. Next slide. So back to our case. So our patient, our 15-year-old client, discloses that he's been vaping nicotine daily. And he's been doing this for over 2 years. So he started when he was 13. So thinking about the factors that are the risk factors that we described. So it's daily use, started when he was 13. He denies vaping cannabis, screens positive on the craft. And we're saying for problematic substance use is just a generic way of framing a positive score. He's also reporting now poor school attendance. When we are just kind of engaged in a dialogue, he generally is quite withdrawn. He's a little bit concerned about his mood. And he also reports that his father was prescribed an antidepressant. So really kind of delving into that concurrent picture. And so I would just like to pass this over then to Dr. Rotem, who will continue our assessment.
So thank you, Dr. Tulloch, for your referral to our clinic. So yeah, we often get these clients for an assessment. And I have to say more and more these days, also during this pandemic, unfortunately. And just to say something about COVID and vaping, yes, we do see more cases of vaping. Researchers are still doubting whether COVID is actually a risk factor or it's just mediators, because youth tend to be either more anxious or doing other substances that lead also to higher vaping. Generally speaking, we might, us as a healthcare provider, we might less screen, we might less ask about vaping and, by the way, smoking cigarettes, while we do phone assessments and WebEx or these kind of virtual sessions these days during COVID. So that's what reported also by Health Canada. So we are not sure yet about the interaction between COVID and vaping, but we sure have this problem. So what we would like to assess with this young client. So please, if you can move to the next slide. And specifically for vaping, we would like to engage with the client where he is at to try to understand his goals and take the right approach. So for vaping, we would like to know how much he's using, how often he's using, how long, and what measures he's using, like what actual vape he's used from the first generation until the fourth generation, which is most recently in use. Is he using other substances? And with regard to other substances, and I think it's important to mention, let's not forget that tobacco and vaping does not go under the title of recreational drugs. So if we ask, are you using substances? You get no. Still, you have to ask about specifically vaping and cigarettes, because then you guess, oh yes, I'm vaping, because nicotine does not consider to be like hardcore illicit substances. So, and here we have to be specific about drugs. I usually have my own list of, and going substance by substance when I do the assessment and be more specific. And with regard to other physical or mental health, so physical physical health were mentioned by Dr. Trish. With regard to concurrent mental illnesses, so there's no other ways to emphasize this more than saying that if your client is using any substances, including nicotine, daily, you should go and seek and search for the concurrent mental health. More than 60%, and sometimes 90%, depends where you read, reported to have either ADHD, conduct disorder, or what we also known as called as externalizing behaviors, or even more often internalizing problem, like they self-medicate for depression, anxiety, sometimes early psychosis, and bipolar disorders. So if someone in the early ages, like teens, 14, 15s, meet criteria for severe use disorder, please search for the or exclude actively the concurrent mental health issue that he might have, because it's extremely rare to see someone who's vaping all day and using other substances, and that's all he has been doing with no any other mental illness, and there's lots of written about it. Next slide, please. So specifically what, and you can please put on the slide, thank you. Specifically what we are asking, so what are you vaping? So nicotine, no nicotine, cannabis. Let's not forget that these days on the fourth generation e-cigarettes or vaping, they can add cannabis oil, THC, CBD, but we are not covering cannabis in this. This is beyond the scope of this presentation, but we have to ask also about cannabis. What e-liquid type do you use? And we know that there is using juices and several other extracts that they add in order to avoid the bitterness of the nicotine. Then how do you vape? What kind of device? I sometimes ask them to show me the brand and where they purchase it. With regard to the how much, it can go by pods, by modes, by sticks. You can see here this green sample of card that someone just invented to work with his clients. What we have been doing in CAMH, and you can do it also in your services. You can see what's most, you can search what's most common, and just take picture of it and save it and show to your clients, and then ask them how much of these specific pods you are using, and then you can count with them. It's also a good way to monitor later on. With regard to how much nicotine, so we are asking about the nicotine concentration. Usually it goes by milligrams to milliliter, and how much the e-liquid that they use per day, like or per cartridge. Next slide, please. So our client told us that he uses nicotine and store in a vape pen and cartridges. He uses the fourth generation e-cigarette. He pods modes. He also shows us the USB that is beautifully recharging, and sometimes we even don't understand how they do it with the application. It's so complicated. So we asked them also to show us how he's doing it. He's using a slightly high dose of vaping, like cartridges of 50 milliliter and 2 milliliter per pod every 20-30 minutes. He starts using within 30 minutes from awakening, starts vaping, and then, as you see, throughout the day. He uses 5 to 6 pods per week, and it takes him 1 day to complete a pod. Here you can see a typical pod, which is 15 between, there's a wide range, so between 15 to 100 milligram of nicotine salt, which can be, as you see, up to 5% concentrate. Just to remind you that cigarettes can be between 1 to 3 milligram of nicotine. So this can be very, very hard on the young development brain. And this is the nicotine equivalent also that you can see. And you can translate if you feel more comfortable working with tobacco smokers, how you can translate it to packs of cigarettes. And next slide, please. So we would like to know how much our client is dependent. Also, and we can use several, there are at least 8 or 10 even well-validated tools to get a sense how much he's hooked on the nicotine, how much he can't. If you don't have time, you can just ask him how much do you vape, how soon you start vaping from awakening, like we do with cigarettes, and it's good enough. But here is a 4-item questionnaire that you are welcome to use. It's validated for adolescents as well. And as the highest the points he gets, the highest risk to be addicted to nicotine. And please, next slide. And this is the also well-known Hooked on Nicotine Checklist that you can see it screens, it's assessed actually for behaviors that related to a vaping use and how much he may be dependent on them and how much the nicotine actually penetrates his life. And here one, as you see, more than 0 or at least one question answered yes. It says, it speaks about clients being probably addicted to nicotine and warrant further support for him quitting. So there again, we can provide you, or we might provide you with more, but you can pick any other of these for you to use. I would suggest you stick to one of them when you are getting to assess how much your client is really dependent on nicotine. Next slide, please. So I understand that my client is highly addicted to nicotine. He's vaping a lot. And what would be my next step now with him? Just if someone can just shout out on the chat. Let's say I know what I'd like to do with him, but if you can share some more info, okay. That's okay. That's part of what? Okay, just because we don't have time. So at this time, I know you all know it because you're all experts, but this time, okay, thank you very much for Mary. I think Mary mentioned the motivation. Thank you. Next step, next step, please. Next slide. So at this point, we would really want to assess where the client is because we know what's the best for our clients, right? We are all healthcare providers. We all get prices for it, but when we work with adolescents, and that's what I think the beautiful in child adolescent psychiatry, the arts of our care providing is to know where the clients are, to meet where they are. I believe that my clients never waste time when they're coming to see me, but sometimes I don't understand where they really are. So we have to, it's like a dancing, right? We dance together in order to understand where they are. You'll be surprised by this most recent publication in Journal of Pediatrics, which I hope you all get to publish there. It's a very good journal, which just showing us that more than half of the adolescents who vape, this is in the States, very large cohort, that said that they intend to quit, and about 2/3 have tried to quit during the past year, and this is about vaping. So apparently, most of the adolescent vapers seek to stop vaping. So the odds that your client would be ready to vape, ready to quit vaping when you meet them is pretty high. Like you might see a vapor that actually even seek support. And that's what we are seeing these days. I mean, when I see clients that are even using cocaine, doing opiates, they do vape, nicotine, alcohol, and I ask them, okay, what would you like to work on first? I'm not surprised that they're telling me, let's start by the nicotine, leave the alcohol for later on. And we discuss, of course, harm reduction, about other substances, but often they will start with the vaping. So let's not forget this, and please, next slide, please. So we'll have to assess their readiness to quit, and you might use this readiness ruler. For instance, on a scale of 0 to 10, 10 is the highest. Where do you find yourself ready? Sometimes I'm assessing also with, you know, this imaginary button. Imagine that I have a button here where I press, you would stop vape. Should I press it or not? Some clients say, sure, press it, no vape. Sometimes, wait, let me just think about it. I'm not sure. Or you can develop your own ways to assess motivation. And then from here, we would like to see where the client is according to the stage of change of Prochaska and Di Clemente. Please, next slide, that I'm sure you're all familiar with. I'm just to remind yourself that many of our clients are probably pre-contemplation or contemplate in the contemplation shelf. I mean, if they are action, probably they won't see you, or they're doing it by themselves. They're just quitting vaping, or they seek support with their peers, or they're fine with it. But most of the clients, I would say, they're either pre-contemplative or they just think about it. So we'll have to elicit a conversation about engagement and taper up the motivation. Just ask some questions that might clarify the situation, provide some more education, of course, with their permission, and then provide more accurate, and it's important to be very relevant and accurate, because they are very aware, they are on the web, they can provide you much more information sometimes that we know, and so we have to keep up, we have to be very updated, and then have this again dance and see where they are in order to elicit change. We want someone that is pre-contemplative, did not even think about, he was coming just to discuss about his medication for antidepressant, and here is starting even thinking about, perhaps I might consider stopping my vaping. That's what that would be the goal for this session, because the next session we can continue thinking about it. So it might take more than one session to motivate someone, to drive someone into action, as you see. And sometimes this cycle is running within somebody in the same day. It's classic within smokers, tobacco smokers. We believe that also with vapers, they have this, they're moving from preparation to action like this. They try to drop the vape, then they feel they go into withdrawal, then they again take it back again, and again have this their own motivational internal discussion. So again, it's important to meet where they are and then move from there. Next slide, please. Yeah, we can. I think I believe we've discussed this. So if you can just So we ask this client, help me understand why would you like to continue vaping. So he gives you classically why not. So he tells us, he gives us these reasons: enjoy the rush, enjoy the social aspects. When he's anxious, vaping helps him to remain calmer, increases ability to remain focused, decreases appetite, which helps him to lose weight. So these are many, as I see it, those that the clients open for us that we can consider going through them while we work to elicit motivation. Second thing that we can see here is considering some concurrent issues that the client might self-medicate. For instance, if he vapes to feel better, if he vapes to do better, we'll have to consider target these issues. Because I have many clients that's telling me, I won't stop vaping unless we figure out how I can perform better in my math classes, because I have learning disability, or for instance, ADHD. I won't stop vaping unless my mood is getting better in other ways, so forth. So whenever clients start giving us some idea of what he's been experiencing, I think we'll have to enter this door, not necessarily on the same session, but we make some comments, and with his permission, we might go there later. Next slide, please. So what might be offered on the spot? So we screened. We may provide brief intervention by enhancing motivation and see where his readiness to change. And if we feel good, we feel ready, we feel confident enough, we might provide some intervention, or we have to refer him to someone that can proceed with it. But what we don't want to do is just make and just leave it like this. That won't be good enough. We have to make sure that someone is following with him, and we will follow with this person that will provide the best care for our client. Next slide, please. So what are the evidences for treatment for vaping in adolescents so far? So we know that psychosocial counseling and pharmacotherapy are effective in adults, and lots of treatments and intervention for adults are taken off-label for adolescents these days as well. Just because we know that vaping might be harmful, and our clients seeking support, and we would like to offer them something that we know it can be controllable and less harmful than just telling them, listen, keep on doing what you do until you'll be an adult. And it happens a lot with other situations in other psychopathologies, also with vaping. So we know, if you can go for the next slide, psychopathology, we will provide education and about the harmful consequences, about the medical / psychological aspect of emotional aspect of vaping with relevancy to the clients. I hear sometimes from the clients that what might be interesting for them, that they have to stop smoking or vaping because they can't attend school. They just resume school in person. They are not allowed to vape. They have to go out from school and from the class outside or into the washroom. They don't know what to do. That can elicit some motivation. They don't mind about the popcorn lungs. They don't mind about the lung cancer. I mean, they mind, but they don't see it as relevant for them. Otherwise, we should provide behavioral intervention. We know that CBT, DBT, and of course, motivational interview is effective for youth. With regards to the pharmacological intervention, and also minding of the time, if you can go to the next slide, we do use, I just mentioned it. If you can skip to the next slides of the nicotine replacements. It's important to mention nicotine replacements are recommended for smoking cessation in youth. What about vaping? So we are not sure yet how much nicotine replacements are effective for vaping cessation. However, since we don't have anything else to offer, and if we have clients that are dependent on nicotine and they want to quit smoking, we will certainly make all efforts to help them, including with prescribed or controlled nicotine replacements. So for instance, we will offer them 1 day to stop smoking, vaping, start with short-acting replacement or a patch, see how they do, educate them about nicotine toxicity, and then take it from there. I can tell you that from the nicotine replacement clinic at CAMH, we have so much successes with youth and nicotine replacement. So we hope that it will grow, but don't forget that these might be solutions for those who really hooked on nicotine and want to quit. The medications for smoking cessation are not we cannot prescribe them below the age of 18. as of now. We are anticipating a study, so hopefully we can provide some more news soon. So I also minded of the time, and I tried to cover very briefly lots of issues that perhaps we can have a separate or further discussion in another meeting, because I know that might be lots of questions. But if you have any clients that you'd like to consider for referral, or you'd like to discuss, you have my email, and I'll be more than happy to provide you more consults. So thank you for listening, and I hope that you will provide help and support to your younger ones, because the need is growing for sure, regardless the pandemic. After the pandemic, hopefully, it seems that substance use, including vaping, is growing. So thank you, and passing it back to Trisha and to our moderator.
Yeah. Trisha, do you want to say something?
No, I was just going to say the same. Thank you. And I know that there is a lot to cover. So absolutely, it'd be great if we could continue that conversation even over email. And I'll just note that in my email, it's just my so Trisha with an A, just maybe just for everybody's information in case you don't get a response. trisha.tulloch@camh.ca, just in case.
Yes, thank you for noting
No
that. I'll put that in.
I just wanted to make sure everyone was aware of that. Yes.
Yes. So thank you both for such an engaging and informative webinar. I know vaping and youth especially is a huge topic right now, and a lot of people are eager to find out lots of information, and it seemed like everyone really learned a lot. So if you have to head out, no problem, because we are past time. If anyone does have any questions, yes, you can either email Dr. Amit Rotem or Dr. Trisha Tulloch. I did put her corrected email in the chat. And for anyone else that's still around, just before we head out, I just wanted to remind you, let me just change the slide, that this webinar has been recorded. So I will be distributing a link to that, as well as a copy of the slides, to you all this afternoon. And please feel free to share this with your colleagues. Along with this, I will also be sending a link to the evaluation and post-learning assessment that must be completed by next Wednesday in order to receive your letter of completion. And then we also just want to take the time to let you know about our next webinar coming up on October 13th. That will be on the topic of adapted CBT for youth, and we hope to see you there. If you missed anything today, we do have our archive list that can be found on our website. For now, thank you all so much for listening and participating today. We hope you all have an amazing rest of your day. Thank you, everyone.